just letting you guys know that we will be recording the session. And good afternoon, everyone. Thank you, everyone, for being here. We really appreciate it. My name is Juliana Argueta. I'm a third-year public health major at Cal State Fullerton. I am also the ICC representative for ESG, the club that is hosting this event. And I represent ESG during our intercouncil club meetings for the College of Health and Human Development. I am studying public health to become a physician's assistant. I plan on taking the prerequisite courses at a local community college once I graduate from Cal State Fullerton. And I plan to graduate in the spring of 2023. So it's very exciting. And some fun facts about me are that I work as a barista at Starbucks and that I have a Disneyland annual pass. So in this breakout room, we will have two presenters. Our first presenter is Brynne Burrows, who will be discussing food insecurity rates among WIC participants during COVID-19. Brynne Burrows is a third-year undergraduate student at UCLA studying human biology and society and Spanish community and culture. During COVID, she has worked specifically with women, infants, and children to promote overall good health and provide nutrition education resources specifically in critical periods of growth and development. Brynne is interested in the health disparities that exist within vulnerable populations and appreciates public health as a field that addresses these complex issues with personal and system-wide solutions. So without further ado, go ahead, Brynne, and take it away.
Thank you very much. I'm going to share my screen. Just let me know if you can see it and hear me. Okay, perfect. Good afternoon, everybody. Like Juliana said, my name is Brynne. I will be presenting on the effects of COVID-19 on WIC participants, specifically in Ventura County. Our research team consisted of Dr. Dena Herman as our faculty mentor, Rachel Kimmel, Violet Jimenez, and Noel Lawson. We are affiliated with both California State University Northridge and the UCLA Fielding School of Public Health. Our collective passion for parents of small children and serving the community through food education and interventions to reduce food insecurity has brought us together to put our efforts into the research project called Family Kitchen. We will be presenting on food insecurity rates among WIC participants during the COVID-19 pandemic. And before I start, here's just a table of contents, what I will be going through today. So our study is part of a larger research study called the Family Kitchen Ventura County, which is a nutrition education initiative aimed at promoting healthy eating and shopping habits while on a budget. So I will provide you with a brief introduction, some background information, the methodology of our study, the data analysis and results from our research focus on food insecurity. So first, our objective of the study was to determine the effects of the COVID-19 pandemic on food insecurity rates and food access in an online virtual nutrition education program conducted in partnership with the WIC program based in Ventura County, California. So according to current literature on the food security status of WIC participants, the extent to which the COVID-19 pandemic has had a negative impact remains unclear. So we aim to assess those characteristics associated with greater rates of food insecurity, as well as any major themes which prevented adequate food access during the COVID-19 pandemic. All right, here is some background. So our research focuses on the Ventura County WIC population. WIC stands for Special Supplemental Nutrition Program for Women, Infants, and Children. This assistance program serves pregnant, postpartum, and breastfeeding individuals, infants, and children up until 5 years of age. So qualifications include being low income, which means incomes below 185% of the federal poverty limit, and being classified as at nutritional risk. So in order to give you a number value to be able to visualize this, it changes annual. So in 2022, being within 185% of the federal poverty limit looks like earning $51,338 or less annually for a family of 4. Our hypothesis predicts that based on pre-survey responses, COVID-19 has significantly decreased the food access and food security of low-income WIC participants in Ventura County within our study dates of March to December of 2021. Furthermore, we predict that Hispanic and Latinx identifiers and Spanish-speaking participants are disproportionately affected and face increased barriers to food access as compared with their non-Hispanic white English-speaking counterparts in the study. So next we have our literature review. And across reviewed literature, it was very evident that the COVID-19 pandemic has stressed the importance of enrollment in programs such as SNAP and specifically WIC. Underlying health disparities in low income and vulnerable populations were exacerbated and resulted in an increased gap in food security. And some of the themes outlined here will be very consistent with the themes that we found in our qualitative analysis, including employment loss due to the COVID-19 pandemic, greater reduced incomes for those already below the federal poverty line, fear of leaving one's residence or exposure to coronavirus, and satisfaction of remote service delivery of WIC education and virtual visits. I would like to mention here that the virtual format could pose as a barrier to those that may not have internet access, but after many consultations with WIC staff and directors, we were informed from the Ventura County WIC department that our participants did have phone and internet access to participate and enroll in our study. All right, so next we have our methodology and study design. Over the course of 10 months, we completed a cross-sectional pilot study with a total number of participants of 358. Like I said, in order to be eligible, they were Ventura County WIC participants, 18 years or older, and we offered all of our resources in English or Spanish so that we could help more people. And then they were recruited through Ventura County WIC, which means that staff spoke with their clients during their regularly scheduled appointments, offered the program as a way of meeting their nutrition education requirements to satisfy WIC, and then in return, they would continue to get their benefits. The study was approved by the California State University Northridge Institutional Review Board, and we conducted a prospective mixed methods pre-post survey design. So all surveys were available in English and Spanish, self-administered online through Qualtrics, which was accessible through our project website. The pre-survey included 7 demographic questions, including sex, highest level of education, race, ethnicity, household earnings, how many people lived in the household, both excluding and including children under the age of 5, and then the USDA 6-item short form food security survey. All right, so we conducted our data analysis through descriptive statistics and bivariate analyses, including chi-square analyses, to determine the association between demographic variables and rates of food insecurity. So the demographic variables I previously mentioned on our pre-survey included language, age, education, race, ethnicity, income, and number of children in the household. Responses to an open-ended survey question, which reads, has COVID-19 had an effect on your family's access to food? Please explain, were coded for themes and sub-themes using a thematic analysis, which I will present later on. All right, so our results. We found that 47.5% of all of our 358 participants were food insecure after being scored according to the USDA ERS, which is the Economic Research Service that scores that 6-item short form that was on our pre-survey. 36.1% of our participants reported difficulty with food access, according to that open-ended survey question about COVID-19. The older study participants over the age of 30 reported a statistically significant increase in food insecurity as compared to the younger participants, 51.7% to 38.8% respectively, with a p-value of 0.05. And then lastly, our Spanish-speaking participants experienced greater difficulty accessing food compared to English speakers, according to that open-ended question, 44.1% to 31.4% respectively. And then moving on to, here's just a visual of one of our demographic questions. So this is the racial profile breakdown of all of our participants. So about half identified as white, 17.1% identified as Latinx or Mexican. And then we also had 17.8% identify themselves as other, which meant that they had the option to self-select their race if they didn't feel that they fit into just one singular race category. So many of the other responses included Mexican American or Black and Latinx. So it was usually a combination of two that we provided here. These are four major themes that we identified in our qualitative analysis. So after gathering all of the quotes and responses from the pre-survey open-ended question, we found that a majority of people reported fear of leaving the house during the pandemic, lack of food available at local markets, significant or complete loss of employment, and increased childcare responsibilities. So this is kind of the overarching themes, and then I will show, this is more quotes, direct quotes from our participants here in response to that open-ended question. So looking at the top row for our English-speaking participants, one theme was received aid from an external source. So one participant writes, "I lost my job in 2020 due to COVID and I applied for CalFresh, but the process took so long. There was a point in time right after I got laid off when we didn't have money for fresh food." And then on the bottom row, my Spanish major came in handy, so I did go through and translate the Spanish-speaking participants' quotes into English for this presentation. A Spanish-speaking participant wrote that sometimes people bought food in large quantities, and when I went to buy, I couldn't find anything that I was looking for. So a lot of similarities here across the board between all of our participants and what they struggled with in terms of food access during the pandemic. And then as I wrap up, I just wanted to go through some future recommendations that we gathered as a result of this study. So our research team as a whole recommends future nutrition education programs like the Family Kitchen, in which healthy eating, cooking skills, and grocery shopping on a budget are taught and promoted for low-income groups. Similarly, the virtual format assisted WIC participants by relieving them from going into the WIC offices for services during COVID isolation, allowing them to save time and save money by being at home with their children rather than paying for childcare services, and avoiding the fears that they mentioned in these quotes here. Other social determinants of health must be examined when talking about food insecurity among low-income vulnerable groups, such as housing, employment, and living wages, as well as childcare. All of these should be further researched in order to appropriately address food insecurity during the COVID-19 pandemic, because more than one of these factors affects all of our participants. And here are our references. That is the end of my presentation. We would like to thank Share Our Strength and No Kids Left Behind for their support of this project. I would also love to thank my team who helps and supports me through this presentation. I would love to answer any questions that anyone has. Otherwise, thank you very much for your attention.
All right, thank you so much, Brynne. That was great presentation.
Thank you.
So if you guys have any questions, go ahead and put them down in the chat or feel free to unmute yourself. In the meantime, while you guys think of some questions, I actually have a few. So my first question for you, Brynne, is So from this study, what was something that you and your team would do differently, and what was unexpected from the results of the study?
That's a really good question. I think one thing that I would have liked to do, we gathered a lot of our information from a pre-survey. So this was before they went through any of our educational resources, before they watched our cooking tutorials and our videos. I would have loved to have another survey like afterwards with the same questions, to kind of see how it changed, or how our study had kind of an impact on their food access, or how like the trajectory of the pandemic affected their food access, because a lot of our responses were like beginning of the pandemic, when there was like the shelves at the grocery store were just like cleared out, but I think some of the challenges changed. And so I think that would have been a really interesting kind of data point to have over the course. And then another challenge that I faced with some participants was just kind of once they were enrolled in the program, either not having like their full demographic profile, or like having a hard time reaching them or getting through to them. Like part of my tasks a few months back was calling for follow-ups to get all of the information filled out on the surveys, and some people it just was difficult to reach them, and our participants are just so busy and have a lot of other things going on, which is understandable, but that was one challenge that I faced during the project.
Thank you. And I also wanted to see, so you mentioned that you guys did cooking videos. So what made you want to pick cooking videos for your like synopsis, I guess?
Yeah, so since it was part of WIC, which is supplemental nutrition, for me, when they enrolled in the live cooking classes, they actually received the ingredients for that meal. And so we tried to draw on both ingredients that maybe they haven't seen before, to try to help the kids learn about tasting new food, but also some staples that they might have already had in their fridge or cabinets. And then teaching the cooking skills and how to kind of budget and shop for the items. I feel like that lasts longer. That information and that knowledge extends beyond our project, and is something that they would be able to use even on the outside, or once this project is done. They will have those skills and that knowledge, rather than just providing them with the food and not knowing what to do with it.
So you wanted to like combine like what they know versus, and then also with what they didn't know, instead of like throw them out of the blue, you know?
Exactly. And we tried to make all of the meals culturally appropriate, so that it wasn't something so unfamiliar to them that they wouldn't be willing to try or taste it, because it was actually really cute. We had a lot of like the kids on the Zoom calls with the parents helping them cook, and we would ask them like what colors they see and what shapes you can make out of it, and how you can kind of have fun with your food, so that it's not so much of a chore as like a family bonding activity.
That's nice. Good to hear.
Yeah.
And then another question that we have is, if there was one message that you would deliver to policymakers that would enhance your services, so WIC, what would that be?
That's a good question. I guess two different parts, one of which, after going through all the literature, I definitely saw a common theme of the difficulty that people who really could use WIC have just with enrollment. And so making it easier for people who clearly qualify and are clearly should be like enrolled in on this beneficial service, who are not, still making that priority in policy, and either whether that's helping them enroll with some form of like social or service worker, or making the actual enrollment requirements easier so that people can get the help they need faster. That would be one recommendation. And then another one would just promoting more nutrition education programs similar to this one, because the part about shopping on a budget and teaching skills that will hopefully extend from parent to child, like down generations, I feel like is something really valuable to invest in, and should be paid attention to, because women who are either expecting or have young children, their health in their child's health in those critical periods of development is so important to take care of and pay attention to, and food is a huge part of that.
Yeah, I agree because personally, I'm very fortunate because my mom is able to cook full time, and so I feel like I have that sense of food security because like she can pass and she cooks and she cooks like healthy foods, like because we're Peruvian, so my mom
Okay.
cooks like Peruvian meals, so I'm able to pass down those. She's able to pass down these recipes to me that I can use when I, would grow older, like move out and stuff.
Yeah,
But
exactly.
but a lot of people don't have this luxury, so I can see why it's important to push for others to have people who don't have the same luxury that I do, to have push for programs that can help people learn how they can have access to like foods and stuff. So
Yeah.
very nice. And then one last question that we have for you is, given that we have a lot of student attendees here, we would like to see, do you have any opportunities for students? And if so, how would they get involved? If not, how would a student be interested in this issue or working for your organization? What experience should they get and where would you direct them to?
That's a really good question. I know that two members on this call, Violet and Noel, they are both still kind of leading the project. And so they, I'm sure, would be happy to have additional students if anyone is interested in helping on the project. But I would definitely suggest that other students, like I had no idea about kind of like all the opportunities that exist in the realm of like food insecurity and social sciences research. So looking into fields that you're interested in, like our supervisor, Dr. Dena Herman, was my professor actually at UCLA in a maternal and child nutrition class. And I was so interested in all the subject material that I reached out to her and asked her about her opportunities. And so definitely reaching out to people whose interests and whose work aligns with what you are trying to get into would be a huge recommendation, and using the network around you and all the educational resources to your advantage. But I feel like through this project, I personally found a huge passion in teaching, and specifically teaching cooking and nutrition to kids and families. And so I feel like experiences like this one, where I got to learn something new and challenge myself in a way that I hadn't before, I would definitely like invite and ask all students to find similar opportunities in their personal fields of interest.
Thank you so much. And for those who can't see, they put their contact information in the chat. So it looks like Noel put the website, or Violet put the website link below. So you can go ahead and check that out if you'd like to see more information on behalf of more studies like this. Thank you so much, Brynne, for
Thank you.
it was very informative. And now
Thank
we
you
will
so
move
much.
on. We will now move on to our next presenter. So our next presenter is Lilly Nhan, who will be discussing food insecurity rates among Asian Americans in California. Lilly is currently a fourth-year doctoral student in the Department of Community Health Sciences at UCLA, Fielding School of Public Health. Prior to this, she received her MPH in Public Health Nutrition at UC Berkeley. Her research interests focus on investigating the effectiveness of federal nutrition policy and programs such as SNAP, which is also known as CalFresh, in addressing food insecurity and diet-related health outcomes among vulnerable populations. So go ahead, Lily, and take it away.
Great. Thank you so much, Juliana, for that introduction, and great job, Brynne, on a really interesting presentation. I'm going to go ahead and get started. Can you all see my slides? Okay, great. Yeah, so today, as Juliana mentioned, I'm going to be talking about food insecurity among Asian Americans in California from 2011 to 2020. So as an introduction, we've already heard about food insecurity a little bit from Brynne. I'll just kind of provide a brief definition. So food insecurity is when an individual or a household has uncertain or limited access to adequate food for an active, healthy life. In 2020, approximately 10.5% of all US households experienced food insecurity, and this is according to data from the USDA. So while we have information, overall at the national level for food insecurity and for certain racial ethnic groups, there's actually very little known about the food insecurity status of Asian Americans, and particularly among Asian American subgroups. We've noticed that among national surveys or even state surveys, Asian Americans are typically aggregated. So we know that there's a lot of heterogeneity among Asian American subgroups. It could include Chinese Americans, Vietnamese Americans, Korean Americans. And so any differences between these subgroups can be masked when all of those data are aggregated at that scale. So the aim of this research study was really to look at the prevalence of food insecurity among Asian American subgroups and examine what sociodemographic risk factors for food insecurity exist among those Asian American subgroups. So to do this, we had to find a data set that actually provided disaggregated data for Asian American subgroups. And so at UCLA, we're lucky enough to have the California Health Interview Survey, also known as CHIS, which is a publicly available data set. I'll kind of put that out there for all the fellow students. If you're looking for a data source, this can be really helpful. It's a statewide health survey that's administered via telephone and online. And like I said, it's overseen by the UCLA kind of Center for Health Policy Research. The CHIS survey is conducted continuously on an annual basis. And so the years of data that I used for this analysis was 2011 to 2020. And in particular, I used the 2-year data files. So if you go to the CHIS website, there are 1-year data files that are available for public use. The 2-year data files you have to apply for just because they do provide that detailed subgroup data for Asian Americans. For my analysis, I just restricted it to adults who are ages 18 years and older. And in terms of methods, I started out with just the basic descriptive statistics, which include univariate and bivariate analyses, and survey weights were pooled for multiple survey years. And that just allows for us to get representative estimates at the state level for California. So just a short note before I jump into the results, in terms of how food insecurity was actually measured in CHIS, they use the USDA 6-item food security survey module, which is just a list of 6 questions that are scored and then ranked to assess food insecurity. For me, I dichotomized this to either yes, they're food insecure, or no, they're food secure. And within CHIS particularly, only adults with household incomes no greater than 300% of the federal poverty limit were actually asked this question. So, earlier in the presentation, I mentioned that, 10.5% of households experience food insecurity, and that's overall among everyone. So when I'm presenting these food insecurity rates, this is really focused on the groups of people who have incomes no greater than 300% of the federal poverty limit. So you'll see it's a little bit higher compared to that overall number in the introduction. Okay, so first off, I just wanted to present food insecurity rates overall by all racial ethnic groups. And so you'll see that the highest rate of food insecurity was seen among American Indian and Native Americans. And that's followed by those who identified with 2 or more races. And both of those groups experienced food insecurity rates of above 50%. Non-Hispanic Asian Americans actually experience the lowest rates when we aggregate them all together at approximately 30%. Now we've broken out the food insecurity rates among those non-Hispanic Asians by the subgroups where we had enough data available. So that includes Chinese, Korean, Filipino, and Vietnamese. I recognize that there are many other subgroups of Asian Americans. Unfortunately, with the sample sizes within the survey data, we couldn't get stable estimates for those other groups, but for these 4 groups, we could. So overall, you'll see that food insecurity rates are highest among the Filipinos, with rates at approximately 38.6%, which is higher than what we were seeing when we were aggregating all the groups together. Followed by the Filipinos are the Vietnamese Americans, who experience food insecurity rates around 28.9%. And so now I'm going to present some results by socio-demographic risk factor. So first we have the results presented by age group. And so there are 3 age groups listed here, which are 18 to 39, 40 to 59, and 60 years and older. And you'll see that for the Vietnamese and the Chinese, the general trend is that food insecurity increases as groups age. So this group of adults aged 60 years and older experienced the highest rates of food insecurity compared to the younger age groups. Interestingly, for the Filipinos and the Koreans, the trend was slightly different, where the kind of middle-aged adults actually experienced the highest rates of food insecurity compared to the 18 to 39 or the 60 plus. I'll note that the differences between the age groups was really only statistically significant among the Chinese group, though. Next, we'll look at results from education level. So here we have 3 educational levels presented for each of the Asian subgroups, and that includes those with a high school degree or lower, those with some college, and then those with a bachelor's degree or higher. And you'll see that overall, when we look at education level, those with a bachelor's degree or higher generally had the lowest levels of food insecurity, which is what we would typically expect and what we've seen overall at a national level. I do want to note for the Filipino group, we had some surprising results where the folks who had some college or a bachelor's degree or higher actually had slightly higher levels of food insecurity compared to those with a high school degree or lower, which is opposite of the trend that we're seeing for the other Asian subgroups. But I will note that the differences between the education levels for the Filipinos was not statistically significant. So it may just be that, within the survey period, we're seeing differences, but they're not actually statistically significant. But overall, this really highlights the need in terms of addressing food insecurity among those with lower levels of education. Next, we have the results for food insecurity by English proficiency. And so this was self-rated among participants who completed the survey. And there were kind of 5 choices when asked about how well they speak English. So they could rate it as only speaking English, speaking it very well, not well, or not at all. And so I broke those out into 2 categories where we had those who spoke English either only or reported speaking it very well or well, and then those who reported speaking English not very well or not at all. And overall, we see that for most of these Asian American subgroups, having a lower level of English proficiency seems to indicate a higher level of food insecurity, which is important to note because, within the US, many services and outreach may not be available in the languages that are needed by these Asian American subgroups, particularly the Koreans or the Vietnamese. The Chinese are a larger subgroup, so they may be more likely to receive services in their language. But even compared to those who speak English very well, those services are just not as accessible when needed in a different language. And I will note again for the Filipinos, we're seeing a difference in that even those who report speaking English very well report higher levels of food insecurity, but it may be because in the Philippines, English is actually recognized as one of the official languages in addition to Filipino or Tagalog. So it's likely that Filipino immigrants who come to the US are coming, typically with a higher level of English proficiency overall, since it's considered an official language in that country. And then lastly, I have the results by US citizenship status. And for the Vietnamese and the Filipinos, not being a US citizen, we see higher levels of food insecurity. The trend is slightly different for the Chinese, where we see that there's a slightly actually higher rate of food insecurity among those who report being a citizen compared to those who are not. In terms of citizenship status, I think it's important to look at food insecurity by this risk factor, just because there's differences in terms of what types of nutritional programs are people qualify for based on their citizenship status. So at a national level, we have the WIC program, which Brynne introduced us to in her presentation, as well as like the National School Breakfast and Lunch Program, which if you went to elementary, middle, or high school in the US, you probably were exposed to in terms of the lunch program at school. So both of those programs are available to people regardless of their citizenship status. However, SNAP, which is also known as CalFresh in California, is only available to either US citizens or people who are lawfully present immigrants who meet certain qualifications. So you'll notice that when I mentioned the programs that are available, regardless of citizenship status, it really focused on either pregnant women or children. So there's a little bit of a gap in terms of what programs are available to adults, particularly those who are not citizens of the US. And so, it really highlights this need in terms of ensuring that we have adequate programming and outreach to that group to reduce food insecurity among non-citizens, particularly among the Filipinos and the Vietnamese. Okay, so in terms of conclusions, I did want to note a few limitations. This data was analyzed from 2011 to 2020, which is, about 10 years, which is a pretty long stretch of time. So things very well could have, changed, over that time period, which we're not seeing when we're aggregating it over such a long span of time. Unfortunately, due to the limitations of finding disaggregated data for Asian American subgroups, it was necessary to pull that many years of data in order to get statistically stable results. So hopefully in the future, we may find additional sources of data which will allow us to provide more timely data that doesn't have to be, over a 10-year time span. Also, as I mentioned, it doesn't include smaller Asian American or Pacific Islander subgroups, again, due to that sample size limitations. And also the findings presented may not be generalizable to other areas of the US since this is a California-based survey. But strengths of the study included actually presenting disaggregated data for these larger Asian American subgroups, which is rare, and having statewide representative data for California. In terms of policy implications, we've seen that nutrition assistance programs should target Asian Americans, but it should be tailored and focused particularly to those who are middle to older age, those with lower levels of education or income, and those with lower levels of English proficiency. Okay. And thank you all for your attention during my presentation, and happy to take any questions.
All right, thank you, Lily, for that presentation. Very nice. I liked how in the graphs it went more into detail. So you first did like the different insecurity rates among like different races, and then you went into subgroups of Asian populations, and then you went into like different factors such as education level, and then also citizenship status. So it was very nice. And so if you guys have any questions, feel free to put them in the chat, and then I have a few questions in the meantime. So one question I have for you was, what made you choose this specific group for your research regarding for food insecurity?
That's a great question. So of course, there's a personal interest for me because I identify as an Asian American, but I would say really a lot of the impetus for this actually came out of some work that I've been doing with Dr. Mei Wang at UCLA Fielding School of Public Health. So during the COVID-19 pandemic, there was a recognition of higher levels of discrimination and hate crimes against Asian Americans. So I would say that at the kind of congressional level within California, there were efforts made to kind of look into that and fund research that was focused on Asian Americans. And so the UCLA Asian American Studies Center received a grant to fund research that focuses on Asian Americans. And so part of the work that I've been doing that I've presented is funded through that grant, which is focused on Asian Americans. And it's not just food insecurity, we're just presenting, one, but many other investigators are looking at, health outcomes among Asian Americans coming out of this pandemic and what's happened in terms of discrimination and hate crimes to this group.
And then speaking of the pandemic, how has the pandemic affected these numbers in food insecurity? Do you think they have increased or decreased, or like what do you think?
That's a really great question. So, to be quite honest, there's still some controversy around how food insecurity was impacted by the pandemic. For sure, at the very early stages, around March 2020, food insecurity increased. And I think Brynne showed a lot of that in her presentation as well, where we were seeing, grocery store shelves were bare, people were kind of purchasing large volumes of food out of fear of what was happening. And so it was difficult to find food at the grocery store. And so, surveys that were administered during that time saw an increase in food insecurity. I would say that now that, as the pandemic has progressed, there's been some, not controversy, but due to the economic stimulus payments that came as a result of the pandemic, particularly for lower income households who qualified for that, there's been some evidence to show that it kind of helped reduce food insecurity among those who were able to receive those economic impact payments or receive unemployment insurance or payments when they did lose their jobs. So that definitely buffered the effects. So I would say, I guess my answer to that question is it depends on like what stage of the pandemic that you're looking at. But overall, I would say the key message is probably just like disparities in terms of food insecurity. So, those who were able to either maintain their jobs or qualified for, certain programs, received help and support, but we do know of, certain racial ethnic groups or subgroups that, either didn't qualify, didn't receive those payments, and, suffered quite a bit during the pandemic. And so I think the key there is really acknowledging that there are differences in terms of experiences among, what we saw during the pandemic.
Of course. And of course, regarding Asian Americans, one question I had is, how do you think the model minority stereotype that is placed on Asian Americans in our society affects these rates, affects the data that you have researched?
That's a great question, Juliana. So I would say it definitely has an impact. The model minority myth definitely puts Asian Americans at a disadvantage in terms of researchers' expectations around food insecurity among this group. And even, when we were looking at data aggregated overall, we saw that Asian Americans had the lowest rates, right? So which kind of plays into or continues to perpetuate that model minority myth, which is why I think getting disaggregated data is so important for dispelling those stereotypes that we may have around, Asian Americans. We are not a monolith. It's a very diverse group that come with very different experiences in terms of reasons why they immigrate to the US, their experiences when they're here, levels of acculturation, and just overall experience, living in the US. And so, I presented results which really highlights the higher levels of food insecurity among the Vietnamese and the Filipinos. But for certainly, there are other Asian subgroups that, in my opinion, while we don't have the data, likely have even higher levels of food insecurity. So I'm thinking of Pacific Islanders or Cambodians, Laotians, the Hmong. We know, anecdotally that they have higher levels of need. We just don't have the data. And so I think moving forward, what can really help in terms of breaking down that model minority myth is ensuring that we fund and support research that allows for, focused research on these subgroups to kind of dispel those myths that you mentioned.
Yeah, I agree. I mean, it was even shown in your presentation, how I think it was 4 groups that were in the research, and they're not a monolithic group because there are many more different nationalities that exist within Asian Americans. So yeah, I definitely agree. And then the next question is, this is kind of like a 2-part question, but the first part is, what are some advocacy groups, policymakers, or movements we can follow to help diminish this issue?
That's a great question. So I would say in terms of advocacy groups, I would definitely recommend AAPI Forward. They focus on a whole range of issues related to the Asian American population, but that's a great one. I identify as Vietnamese personally, so another group that I recommend is Pivot I can never remember what the acronym stands for, but they do work focused on Vietnamese Americans as well. Those are the two that come to mind for me in terms of focused advocacy around this group. I'm sure there are many more. Those are just the ones that I am familiar with and have worked with. So yeah.
And then the second part, similar to the question that we asked for Brynne. So, we have many students here. So do you have opportunities for students? And if so, how would they get involved? If not, how would a student be interested in this issue working for your organization? What experience should they get, or where would you direct them?
Yeah, that's a great question. So in terms of opportunities, I would say we do have some opportunities. We're working on a study right now to do some qualitative data around this issue for Asian Americans. So if there are any students who are bilingual in English and another Asian language, that's definitely something that we value and are looking for. In terms of searching for other opportunities to get involved, I definitely recommend reaching out to, professors either at CSU, your campus, or at UCLA. Happy to share my email address to folks if they want to get in contact with any professors who are doing work in this area. And if you're interested in the LA region specifically, I know Fullerton is in Orange County, but in Los Angeles County, there's the LA Food Policy Council, which is really active in terms of addressing issues around this food insecurity overall in LA County. So they're a great group to reach out to.
Thank you, Lily. I want to say thank you to our both presenters for being here today and showing us your presentations. They're very informative, and I can say, I think I speak for all of us when we say we learned a lot from both of your presentations. So thank you so much. And I would like to take the rest of the remaining time that we have to thank our sponsors who sponsored our overall symposium. We would like to thank SoCal AG SURF's Education and Research Conference, Cal State Fullerton Department of Public Health, Cal State Fullerton Center for Healthy Lifestyles and Obesity Prevention, and then CSUF Health Equality for All Lab, or otherwise known as HEAL, Southern California Society for Public Health Education, or SOPHE, the Center for Cancer Prevention, Health Disparities, Research and Training, and CUSF Center for Healthy Neighborhoods. Thank you all for attending our first ever symposium hosted by ESG. We really appreciate all of you guys being here. This was our first symposium ever, and we hope to make this an annual thing within our club and hopefully spread the word more throughout following years. And yeah, if you have any questions, you can go ahead, and I think we're almost done, but if you have any questions, you can go ahead, for our presenters, you can go ahead and stick around, or if not, have a great rest of your weekend. Thank you so much.